pain was incredible. I couldn't even describe it.
I was thinking, oh my God, she can't die.
I don't know what's going on, but there's something wrong with me.
Survival is limited to probably 12 to 18 months.
I was really scared. I didn't marry her just to be with her for 10 years. I married her to be with her until we both got old.
Next, two medical mysteries that defied the experts. Little did Linda Charles know that when she got her first cavity at age 5, it would mark the beginning of a 50-year struggle with a condition that would baffle doctors and eventually consume her every waking moment.
I absolutely had a sense of losing control of my life, that it was no longer in my hands.
Then, Jennifer Gershman's very ordinary life is turned completely upside down when she gains a couple of pounds with very deadly consequences.
I knew that was really serious. I was sure that I didn't have that.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. It was the summer of 1955, and Linda Charles was 5 years old. As a child, she led a seemingly ordinary life, dreaming of a world outside of the Philadelphia neighborhood she lived in with her family.
I always wanted to be, when I was a little girl, a nurse, a movie star, and in the Army.
It would appear to everyone who met Linda that she was a healthy little girl, but as soon as she would smile, it was clear that something was not quite right.
I had cavities and abscesses. We did everything, brushing, flossing, that the dentist said to do. But from the time I can remember, I spent an inordinate amount of time in dental chairs, getting filling after filling.
By the time Linda turns 12, she has had 10 cavities filled. But while she's concerned and frustrated with her teeth, they're the last thing her parents seem to be worried about. They're too busy managing 3 children and struggling to make ends meet.
I think that they were unable to respond to me in the way that I would have wished they could have.
Then, when Linda enters middle school, a strange new symptom begins to emerge. Her mouth is incessantly dry, and she soon develops a very strange habit.
I couldn't eat without drinking. In fact, I started dunking things. I mean, not just cookies, bread, sandwiches, soda, soup, whatever it was, because it made it easier for me to eat. I felt separate and not like the other kids. I sort of isolated myself. When I would get home, I would always have lots of library books, and I made myself happy by living through my books.
During high school, Linda does her best to come out of her shell. But as she pushes herself to do more, she notices that her body is having trouble keeping up.
I would have extreme joint and muscle pain. Everything was more of an effort for me to do, even gym class. So I didn't participate in a lot of things that I really wanted to because I felt so isolated, and I think it made me pretty introverted.
But when the agonizing pains don't go away, Linda's mother finally takes her in to see the family doctor, just in case something is really wrong.
We went to the doctor, and he said, "Don't worry about it. It's just growing pains. It'll go away when you're an adult." I think my parents were concerned, but their mindset, being from this Depression era, tough, hardy individual mentality, they sort of wanted me to tough it out and just get through it.
Through the rest of her high school years, Linda does the best she can to simply grin and bear it. And when her parents announce that they are getting a divorce, concerns about her health take even more of a back seat.
I didn't really see much of my father. My mother was working full-time and worried about, taking care of 3 children. Me not feeling good was never a primary issue. There wasn't time for it. I felt like no one was actually hearing me.
By the time she graduates from high school in 1967, Linda has become accustomed to living with the joint pains, and soon after manages to land a full-time job as a receptionist. In the ensuing years, Linda marries the man of her dreams and soon becomes pregnant. She's excited about the prospect of being a mom, despite the toll it will take on her already fragile body.
It was 1972. Jimi Hendrix, Janis Joplin, and along came my son. I named him Jared Zachary.
Jared was born just about a year after my daughter Edema was born, and we were actually at that time next door neighbors. Having children as young as we were focused both of us. You started to understand that life isn't all about me anymore, ever.
A couple of years after Jared is born, Linda's marriage ends in divorce. But just as she's settling into life as a single mother, an annoying new symptom begins to emerge.
I was constantly going to eye doctors. I had swelling. I had foreign bodies in my eyes, like they're gritty. They thought it was allergies, and I should use these allergy drops.
She diligently follows the doctor's orders, but no matter how many drops she uses, the chronic eye irritation just won't go away. And to make matters worse, she soon starts experiencing yet another symptom, bouts of chronic fatigue that make even the simplest daily tasks seem impossible.
There were times that, as much as I loved him and wanted to play, I was just so fatigued, so exhausted, that I just didn't feel like I could fully participate. And I couldn't. I just couldn't do it.
She was always tired, something always dragging her down. And she did see doctor after doctor, blood work after blood work, but there was nothing ever really definitive.
I was seeing lots of doctors, and I wasn't getting any answers. I got the sense that the people were feeling I was making things up.
While no doctor can identify the cause of Linda's pain, her life begins to unravel, piece by piece.
I used to get fired a lot, truthfully, because if you're sick and you have a new job and you're out for a day or two here and there, within a few months they say bye. I absolutely had a sense of losing control of my life, that it was no longer in my hands.
Linda Charles has hardly known a day in her life without pain. Some days her joints ache so much she can barely walk. Her eyes randomly swell, and no doctor has been able to pinpoint just what's causing the bizarre and seemingly unrelated symptoms. But when she became a single mother, Linda promised herself that despite her debilitating condition, she would do whatever it takes to give her son a good life.
You sort of put aside those things that you think about or dream about for yourself in order to take care of your child.
For more than 8 years, Linda juggles various jobs trying to make ends meet. But then, when she turns 30, she makes a decision that changes her life completely, when she enrolls in nursing school.
In September of 1981, I found myself being a student.
After 2 years, she graduates and quickly finds a job. Drawing on her experiences with her own illness, Linda pours herself into her work.
She had a lot of empathy for her patients.
I think that it made me a better nurse. People often had symptoms that weren't visible, but they were in pain. And I think that I was very tuned in to their emotional state.
Linda musters the strength each day to put her pain aside and focuses on caring for her patients and raising her son. When Jared graduates from high school, Linda is feeling confident enough about her health to tackle her second lifelong dream.
I joined the reserves of the Army Nurse Corps.
Shortly after enlisting in 1991, Linda is sent to an officer training camp in Texas, where she quickly realizes just how strenuous the physical demands of the Army can be. But each time her legs feel like giving out or her eyes act up, she bites the bullet like she has many times before.
I was amazed. I was amazed that she made it through basic training.
I think that a person learns to compensate for a disability. I just kept putting one foot in front of the other until I crossed the line.
Linda seems to be thriving in the military. But then, when she least expects it, a frightening new symptom emerges.
The heartburn would feel literally like my chest was going to explode or implode. And No matter what I took, over-the-counter medication didn't seem to help that.
Linda feels her world begin to spiral out of control again. She is losing weight like crazy, and even more alarmingly, her gastrointestinal issues seem to be making her other symptoms even worse. Doctors prescribe various painkillers, eye drops, and antacids, but frustratingly, none of them work.
But at this point, Linda was being treated for so many different things. There was the eyes and the reflux and the stiffness. Nobody was putting it together as one cohesive diagnosis.
Finally, after 2 years of service, Linda is feeling defeated. Unable to keep up with the Army's demands, she makes the extremely difficult decision to leave the military.
She realized that she had to go out there and find the answers to her own health problems. The military wasn't doing it for her.
When she's offered a civilian nursing job at the Department of Public Health on a base in Arizona, Linda happily accepts. Her son and his new wife, Sonia, have recently settled nearby, and it's a joy to be around family again.
There was a tremendous sense of relief that I was with two people that I loved and I felt safe with.
Despite the comfort of a less rigorous schedule, Linda is still burdened by terrible stomach aches and soon makes an appointment with the gastroenterologist at her new hospital.
I was examined for gallstones, for a gallbladder workup because I just had so much pain in the area of the gallbladder.
For the next 3 days, Linda anxiously awaits the results, praying that she will finally have a solid diagnosis. But when the findings come in, she's no closer to an answer. Her gallbladder seems to be perfectly fine, and her doctor can't offer any advice.
That wasn't very reassuring for me to hear because I was in pain and I was miserable.
Dejected, Linda tries to marshal on like she always has, but the joint pain, intestinal discomfort, and fatigue are beginning to overwhelm her. Now it's taking everything she has in her just to get to work each day.
She would come home and she would lay down and she would have to rest.
Every time I would go to eat, the food would almost regurgitate on me, right after I ate it, and I would get really nauseated and have just incredible burning sensations in my chest and my throat, and sometimes even in my mouth.
Then, one afternoon in 1994, while in the throes of another bout of stomach pain, Linda shows up at the hospital for her shift. But the second she walks in the door, the resident ER doctor takes one look at her and insists on checking her out.
And he said, "You look awful. Let me take your vital signs." And I was running a fever.
As he's examining her, Linda reminds him that just 3 weeks earlier, another doctor suspected that she had a problem with her gallbladder. The doctor immediately reviews her case history and makes a critical decision.
He said, "You know what, I'm admitting you and I'm taking your gallbladder out. I know we can't find any stones, but there's something going on."
The medical team races to prep Linda for surgery, and in less than an hour, she's wheeled into the operating room. Once they've removed her gallbladder, they immediately send it to the lab, hoping to find some clue as to what's been causing Linda so much misery. 2 hours later, as Linda slowly regains consciousness, she notices that something is very different.
I immediately felt better. I really did. I think acutely, immediately, I got some relief. A week later, I had a post-operative visit with the surgeon. And he said, "Linda, I got this very odd pathology report."
Linda is completely shocked when he explains that the tests detected a small hole in the bottom of her gallbladder.
He said, "Linda, it appeared to the people doing the pathology report that the bottom of your gallbladder had literally been eroded by acid, and the contents were dripping into your stomach, which was why you were sick."
The doctor speculates that bile, a highly toxic acid, had been accumulating in Linda's gallbladder rather than being released into the intestines to aid in digestion. As a result, the acid eventually ate through the lining of her gallbladder, causing the bile to leak into her abdomen. This in turn triggered the searing pains she felt every time she ate.
He had no idea why anything like that would happen. He had no idea why.
The surgeon assures Linda that while he has no definitive answer as to the cause, he does expect that she will have a much easier time digesting food now that her gallbladder has been removed. Sure enough, Linda's stomach gives her no more trouble. Unfortunately, she continues to experience joint pain and chronically swollen eyes.
Linda put up a really good front. I think she masked a lot of her pain.
3 years later, she's feeling well enough to venture out on her own again and decides to move across the country. Little does she know that this seemingly routine trip would soon turn into a living nightmare.
My best friend Carol lived in Florida for over 20 years, and I'd always wanted to live in Florida. And I thought, why stop now? On my way there, driving for 3 days, my left eye started to hurt. The pain was incredible. I had never experienced that kind of pain. I couldn't even describe it.
Miraculously, Linda completes the 1,200-mile trip, and as soon as she arrives, Carol takes her to an optician who immediately refers her to a corneal specialist.
You know, he said to me, you have a very serious condition. You have a dendrite in your eye, and you could lose your vision in your left eye.
Like a cold sore, the lesion or dendrite on Linda's cornea is caused by the herpes simplex virus. Up to 95% of the adult population has suffered from herpes simplex 1 at some point in their lives, but very rarely is the infection found in the corneas. The causes are unknown, but it is treatable. Linda is immediately put on antibiotics and told she cannot go anywhere without wearing protective glasses.
Carol, at this point, was driving me everywhere. I couldn't work. The sun's out all the time in Florida, so I was becoming like a vampire where I could only go out at night.
She was very, very light sensitive, to the point where we were sitting in my house one evening watching TV. She said, "Can you please turn the light out? It's bothering my eyes." So I reached up, I turned the light out. She said, "No, all the lights." And I think that was a pivotal moment for me too. I thought there is definitely something more going on here.
Strangely, as her eyes begin healing, the symptoms she's become so used to living with seem to be intensifying.
You could actually see her joints were swollen at times. You could tell by the way she moved that it was painful. Her eyelids were huge and very red.
Slowly, this ever-optimistic, independent woman is sinking into a depression she never thought possible.
I was there in Florida for 9 months, 7 of which I lived on a credit card because I wasn't working. And finally, I couldn't pay my rent. And now I am a totally disenfranchised person with no job, no money, no medical benefits, and no doctors believing that there's anything wrong with me.
Linda Charles has been living with crippling gastrointestinal issues, agonizing joint pain, and chronically dry, swollen eyes for more than 30 years. As she recovers from a series of terrifying eye problems that almost left her blind, she's finding it increasingly difficult to keep up with the demands of her nursing career. And for the first time in her life, she's nearing a breaking point.
The saddest thing that she said to me was, "You know when you want to have a really good cry?" And I said, "Yeah." She said, "Well, you know, I can't cry anymore. I have no tears."
It was the most depressing time of my life, feeling like I had a heavy black cloak that I was dragging around with me because the depression was that disabling.
Linda's eyes have become so light-sensitive that she can't leave the house. And since her move to Florida 9 months earlier, she's used up all of her savings. Overwhelmed, her only option left is to move back to her hometown of Philadelphia and pray that a fresh start will do her some good. But when she visits her doctors back home, they can't seem to find anything wrong with her at all.
I was basically dismissed by them as needing psychotherapy, hormones, that I was a hypochondriac. You know, I just needed to go be referred to the psych department for therapy.
Fed up, Linda decides to take things into her own hands and begins frantically researching medical centers in the Philadelphia area. Ultimately, she comes across Will's Eye Hospital and makes an appointment with ophthalmologist Peter Leibson.
When I first saw her, Linda had joint pains, some dental problems, and Linda had some GI problems. All of these things combined made me think that this might be something more than just dry eyes.
After performing a thorough exam, Dr. Leibson is convinced that there's more going on than meets the eye. Working on a hunch, he decides to run a few more targeted tests on Linda. First, he measures the function of Linda's tear film, the lubricating protective layer on the surface of the eye.
We have the patient blink and open their eye. When they blink and open their eye, the tear film is spread across the surface of the cornea. The tear film breakup time is normally 10 seconds. If the tear film is unstable, it is maybe 1 or 2 or 3 seconds in a patient who has dry eyes.
Just as Dr. Leibson suspected, Linda's tear film breakup is clocking in at only 2 seconds. Next, he performs a test to see how well her actual tear ducts are working.
We measure the production of tears over a 5-minute period. We put a small filter paper strip into the lower lid and have the patient close their eyes for a 5-minute period. And we can measure the amount of wetting of the strip in this period. Patients who have tear film wetting under 5 millimeters are suspicious. Linda's strip measured, I think, 1 or 2 millimeters, and Linda's tear production was definitely abnormal.
But Dr. Leibson cannot guarantee a diagnosis until Linda undergoes one more seemingly unrelated test, a lip biopsy.
A lip biopsy is done by anesthetizing the area to be biopsied, and then a small snip of tissue is taken out.
There are a lot of nerves right here. I can still point to that spot. It was incredibly painful.
Now the only thing they can do is wait for the lab results.
Well, there was a sense of impending doom waiting for the results to come back, mixed with a sense of relief because I'm finally going to get an answer.
Linda Charles has been battling a series of mysterious symptoms her entire life. Crippling muscle and joint pains, eye problems that have left her nearly blind, and bouts of gastrointestinal issues that were so bad she had to quit her nursing job. Now, 50 years after she first started experiencing the bizarre symptoms, one doctor seems to have found a solid clue as to what's been causing this strange constellation of medical issues.
For the first time, I felt that this man was going to hear me and that maybe he had an answer.
3 weeks after the tissue sample of Linda's lip was sent off to the lab, the findings finally come in.
The test results finally revealed that Linda's diagnosis was Sjogren syndrome.
Sjogren syndrome is a chronic autoimmune disorder in which a patient's white blood cells attack the body's moisture-producing glands, such as the tear ducts and salivary glands. It can also sap other organs of moisture, including the kidneys, liver, blood vessels, and the central nervous system. In severe instances, such as Linda's, it's almost as if the body is being slowly drained of its fluids. The exact cause of Sjogren syndrome is not known, nor is it clear exactly how it caused Linda's bizarre gastrointestinal problems.
It's not clear how Linda's gallbladder problem is related to Sjogren syndrome. In studies, about 10% of patients with Sjogren's do have GI problems.
Suddenly, all of the symptoms Linda has had since she was a little girl make sense. Linda's chronic dry mouth is caused by a lack of saliva, which in healthy individuals breaks down food caught in the teeth. This protects the teeth from bacteria, which cause tooth decay. But in Linda's case, her body has such a difficult time producing saliva that she was left with a mouth full of cavities.
Also, Sjogren syndrome may cause the fluid in joints to decrease.
Joint fluid acts as a vital lubricant to cushion the joint and ensure proper functioning. The same antibodies that were attacking her moisture glands were also attacking her joints, causing the bouts of extreme pain.
Putting all of this together, we were able to say, Your joint pains, your dental caries, and your dry eye problem may all be related to Sjogren syndrome, which was undiagnosed for many years.
And just like that, at age 50, after a lifetime of wondering, I had an answer. And that moment was bittersweet. Because, yes, I had an answer. But what does this mean for my future? Do I even have a future? What happens now?
Sjogren's is not fatal. It's just very, very, very uncomfortable. There is really no cure for the various problems related to Sjogren's. We treat the symptoms.
Dr. Leibson immediately prescribes synthetic moisturizers which alleviate some of the joint pain and eye problems, as well as an immunosuppressant that should help keep Linda's immune system in check. While the treatment is by no means a cure-all, for the first time in her life, Linda begins to feel as if her body has turned a corner.
I believe my symptoms are more under control.
I think she's doing much better than she was before.
She's just learned how to work around it. When she's feeling good, she puts everything into that time.
As Linda learns more about the disorder that has plagued her throughout her entire life, she realizes just how lucky she was to have been diagnosed at all. Despite estimates that 2 million people have Sjogren's in the United States, it's often difficult to diagnose because its hallmark symptoms, dry mouth and dry eyes, are so common.
Dry eyes are probably the most common disorder people have coming to a doctor's office. Ophthalmologists and the family doctors who see patients with dry eye have to think carefully that Sjogren's may be present.
Today, Linda is a passionate volunteer with the Sjogren's Foundation, educating others about the disease.
I've learned to join into the Sjogren's Syndrome Foundation and that could be an empowering experience. I'm not letting this disease stop me from doing anything or living my life. I'm gonna go out kicking and screaming.
While Linda Charles spent more than 50 years battling one medical issue after another, Jennifer Gershman was the picture of perfect health for most of her life, until a seemingly harmless symptom left the young mother fighting for her life. In the beginning of 2006, 38-year-old Jennifer Gershman was at the top of her game. A former personal trainer, she'd committed herself to staying in great shape, even after her son Jason was born.
An average day for me was waking up with Jason, getting ready for preschool, going to the gym, working out, seeing my friends, spending time with my husband. Things were great, you know?
Jennifer really prides herself on being a great stay-at-home mom.
But then, in the summer of that year, Jennifer begins noticing that her weight is fluctuating more than she's used to.
I started gaining just a lot more water weight with each of my monthly cycles.
Jen had been talking about the fact that she just felt really bloated, really blah. She didn't know why.
I was gaining 5 or 6 pounds, and it was mostly in my belly, and I thought it was just because I was getting older. I was 38. It was weird, but, you know, every month I would kind of lose it.
Jennifer is disturbed by the pattern she's seeing. So she starts spending more and more time at the gym, hoping to keep the scale in check.
We had to look at our budget and take things out. One of the things that was kind of untouchable, kind of like Social Security, was her gym membership. You just didn't fool with that.
But despite the fact that Jennifer is spending more than 10 hours a week at the gym, she just can't seem to stop the monthly weight gain.
I definitely knew something was wrong when I was at the gym and a woman that I didn't know asked me if I was expecting, and I said no.
The woman's comment pushes Jennifer over the edge. Now she's determined to find out once and for all what's causing the intermittent weight gain. She immediately schedules an appointment with the family doctor.
At first, when she saw my ankles, she didn't seem to get too concerned or excited. Just out of curiosity, I wanted her to take some hormone tests. I had been feeling some fatigue.
The doctor agrees to run a battery of blood tests, hoping that they'll identify what's triggering the monthly weight gain. But when the results come in, every single test is normal. Jennifer is relieved to hear that she's okay, but she's thrown for another loop when a disturbing new symptom suddenly emerges.
A very close girlfriend was getting married in New York, so my husband and I went to New York for the wedding. And when I came back up to my hotel room and I took off my shoes, I had a clear indentation around the top of my foot. I had no definition around my ankle bones at all.
By the time they return from their trip, the swelling in and around Jennifer's ankles has strangely vanished on its own. Then, just 2 weeks later, the swelling returns with a vengeance.
My husband and I took Jason to a friend's house for dinner, and my girlfriend is a nurse. And when I showed her my feet, she told me that that was edema.
Edema is swelling or puffiness caused by water that is trapped in the tissues of the body. It can be a warning sign of congestive heart failure or of kidney, liver, or thyroid disease.
Our friend said, no, this is not normal. You need to go to your doctor and you need to get it, you need to find out what this is.
For the past few months, Jennifer Gershman has been plagued by a very disturbing condition. Every month, she gains more than 5 pounds, and then, almost overnight, the weight mysteriously disappears. Now, a friend who is a nurse thinks Jennifer is suffering from edema, severe swelling caused by fluid trapped in the body's tissues. Alarmed, Jennifer visits her doctor, hoping that this time she'll be able to figure out what's causing the bizarre swelling.
She kind of pushed on my legs a little bit to see if it was pitting, meaning if, you could make an indentation in the skin, and it was, and then the skin would fill up again with fluid.
The doctor quickly confirms that Jennifer is suffering from edema and orders a thorough round of blood and urine tests, hoping that she'll find the clue she needs to identify the cause.
And once she took the blood and urine tests, I felt like, oh, okay, once they come back, they're gonna figure this out.
But when the findings come back, they're no closer to solving the case.
There wasn't anything that jumped out at her, nothing, that showed any clear problem, but she did say something about my protein levels in my blood being low. I thought, well, I eat a lot of protein. That's weird.
The doctor assures her that the low protein levels are really nothing to be worried about. More frustrated than ever, Jennifer walks out of the office, wondering if she'll ever have an explanation for her bizarre symptoms.
It just led to more confusion and more stress because, all these tests are coming back normal, but there's definitely something wrong with her.
And when the fluid retention came back the following month, I was really frustrated. I would actually feel my belly shake. It felt like I was wearing almost like a fat suit. It felt like I just wanted to take it off. My doctor kept telling me to go home and put my feet up, but you can't. When you have a 4-year-old at home. Nice,
5 months after the edema first set in, Jennifer feels trapped in her body, and once simple tasks begin to require monumental effort.
It was getting hard to kneel down if I wanted to kneel down to my son's level. That's where I really felt the tightness in my legs. I was miserable just about the way I looked, about the way I felt, and also I was really concerned.
Then, just when Jennifer doesn't think it can get any worse, she reaches the end of her rope.
We were getting ready to go to Florida, and while I was packing, I had so much fluid retention in my legs and my ankles and my feet. I was in tears. I couldn't pack. I had to put my feet up on pillows, and I just remember calling my mother just in tears, just saying something is wrong with me and they can't find it.
Jennifer does her best to grin and bear it and heads down to Florida with the family. But throughout the trip, she's beside herself. In fact, her feet are so swollen, she can't even put shoes on. On the 3rd day, Jennifer breaks down and calls her doctor back home.
I told her, at this point, I'm really scared. I said, I don't know what's going on, but there's something wrong with me, and now I don't know what to do.
The doctor promises her that as soon as she gets back from Florida, she'll perform a specialized test that she hasn't run yet.
She said, we're gonna collect your urine over the course of 24 hours, we're gonna look at it, and we're gonna figure it out.
So she was really anxious to get back and have the 24-hour urine test done immediately.
As soon as they land, Stephen rushes Jennifer to the doctor's office, where she leaves a sample to be tested. But no one could have prepared them for what the findings would reveal.
My doctor called me the next day, and she said, You're losing protein in your urine. Protein is supposed to stay in your blood.
In a healthy individual, the kidneys process various blood proteins, which help to regulate cell function and the immune system. The fact that these essential proteins are showing up in her urine is a pretty solid indicator that her kidneys are malfunctioning. For Jennifer and her family, the news is a complete bombshell.
When she told me that there was a problem with my kidneys, I wasn't happy about that.
I was scared that my sister would end up on dialysis. And I thought, oh my God.
Her primary care physician immediately refers Jennifer to kidney specialist Dr. Andrei Kuznetsov.
While I was telling Dr. Kuznetsov all of my symptoms, he just listened, tried to explain to me in layman's terms what was going on with my kidneys.
Well, normally people have very, very tiny amounts of protein in the urine, under 30 milligrams that one can excrete per day. She had more like 6,000.
Every 24 hours, the kidneys perform a life-sustaining job of filtering and returning about 200 quarts of fluid. About 198 of those quarts are recycled back into the body, and about 2 quarts are removed from the body in the form of urine. Dr. Kuznetsov goes on to explain that the extreme edema Jennifer has been living with is also a clear sign of a problem with her kidneys. When the kidneys are damaged, they can't get rid of the body's extra salt and water, forcing the fluids in the kidneys to go somewhere else in the body.
There was a quite significant amount of swelling, and she had gained probably 10 pounds of weight, which was all pretty much fluid weight.
All of Jennifer's symptoms point to one very clear and terrifying conclusion.
Most of the time, we deal with decreased kidney function, but in her case, it was a constellation of clinical findings consistent with what's called nephrotic syndrome.
Nephrotic syndrome is a disorder in which the kidneys have somehow been damaged. It's an extremely rare condition affecting approximately 2 in every 10,000 individuals. But nephrotic syndrome is itself only a symptom, indicating a much larger and serious problem with the kidneys.
I asked him, do I have nephrotic syndrome? And he said, you do. We need to find out why.
Year-old Jennifer Gershman has just been told that the bizarre symptoms she's been experiencing, excruciating edema throughout her body and high levels of protein in her urine, are all the result of a potentially life-threatening kidney disease.
I was really scared. I just couldn't understand how, out of the blue, being an active person, someone who exercised, someone who was conscious about my diet, could possibly have a kidney problem.
While Dr. Kuznetsov has a solid hunch about what's causing her kidneys to shut down, it's imperative that he perform a kidney biopsy right away to confirm his suspicions.
I was nervous that he was going to find something wrong with my kidneys, and I had no idea what that entailed.
6 months after her first symptom emerged, Jennifer is admitted to the hospital, where a small piece of her kidney is carefully extracted and immediately sent away for testing. Dr. Kuznetsov includes a request that the lab perform a highly specialized tissue test.
We asked the pathology to specifically look at a special stain called Congo red.
If the disorder that Dr. Kuznetsov suspects Jennifer has is present, the kidney sample will be filled with fluorescent green dots once the Congo red stain is applied. The Gershmans spend the next week anxiously waiting for the biopsy results.
You know, you're trying not to think about it, you're trying to keep busy, but all you can think about is, when are the results going to be in? When are they going to call me? What are they going to say?
Finally, 5 days later, Dr. Kuznetsov picks up the phone to call Jennifer and tells her the news that will change her life forever.
It was found that the Congo red test was positive, and it was positive for what's called amyloid. Jennifer had amyloidosis.
Amyloidosis is a rare and potentially fatal disease that occurs when infection-fighting white blood cells created in the bone marrow are somehow converted into abnormal proteins called amyloids. These proteins in turn gradually begin to build up in the body's vital organs, like the lungs, heart, and, in Jennifer's case, her kidneys. As the amyloids accumulate, the body begins shutting down, like a car with a clogged engine. The exact cause of amyloidosis is unknown, and there's no known cure.
Amyloidosis causes multi-organ dysfunction and eventually organ failure. The usual survival without treatment is limited to probably 12 to 18 months.
The diagnosis leaves the Gershmans shocked and speechless.
When Dr. Kuznetsov said that I had amyloidosis, I knew that was really serious. I was sure that I didn't have that.
I was really scared. I didn't marry her just to be with her for 10 years. I married her to be with her until we both got old. So, I was pretty scared.
But just when Steve and Jennifer think they can't bear any more bad news, Dr. Kuznetsov gives them a reason to hope. Thanks to Jennifer's persistence, the amyloidosis has been diagnosed early enough that it hasn't spread to any other organs. Like cancer, amyloidosis is uncurable, but Dr. Kuznetsov suggests a new treatment that just might put Jennifer into remission.
The best treatment to date is high-dose chemotherapy directed at killing those white blood cells that are abnormal. And this is followed by a stem cell rescue. This is when stem cells are infused into the bloodstream and they create the new healthy bone marrow.
I was really scared. I mean, I was young, I had a young child, I had a really active life, I was coming up on my 10th wedding anniversary.
Because the chemotherapy will completely wipe out her immune system, the smallest infection could be deadly. So Jennifer and Steve will have to temporarily move within 5 miles of the hospital, just in case something goes wrong.
It's not just regular chemotherapy, it's high-dose chemotherapy, which means they essentially almost kill you. And that's really terrifying because, I've heard stories of people having had the same treatment and not making it out of the treatment.
When you hear that somebody needs chemotherapy and a stem cell transplant, you think, oh my God, they might die. And I was thinking, oh my God, she can't die.
But before she says goodbye to her family and friends, Jennifer courageously throws herself a going-away party.
Day before she went into Boston, we had a big shaving her head day. This was a good example of how Jen was dealing with this disease.
In June 2007, 7 months after Jennifer's first bout of weight gain, the Gershmans tearfully say goodbye to their son Jason and check into the hospital.
I would say the worst part of this treatment was being away from my son. He would say things on the phone to me like, "Mommy, I'm getting very angry, and I need you to tell the doctor to send you home because I really miss you."
It's a long and painful series of treatments. But 2 months later, Jennifer is finally ready to come home.
Jen did clinically very well, and we are hopeful that her disease will go into this durable and long-standing remission.
She's losing a lot less protein in her blood. She's improving drastically.
Today, Jennifer is required to check in with Dr. Kuznetsov every 3 months just to keep an eye on everything. While she'll never be rid of the amyloidosis, she is a survivor and plans to be around for a very long time.
And cheese! I'm back exercising at the gym and keeping up with my son and doing all the things I used to do. My immune system has quickly rebounded.
This whole experience, it really makes you not take anything for granted, from your family to your health to your friends. Life is not unlimited, and something as small as fat ankles can be a life-threatening disease.